So let's move on to the next phase, which is if someone feels that they have, again, we're confining our talk to hay fever or allergic rhinitis. What happens to those people if they really are struggling to identify? Well, what happens to they often see an allergist or their primary care doctor who orders allergy testing, and often in the form of skin testing or blood testing, RAS testing. But what's interesting about that testing, which I think nobody wants to talk about, which is I think if you get nothing else out of this video, is this, that, whether 20%, 30%, 10%, 15%, a certain percentage, and it's a big number of those skin tests and RAS tests are falsely positive. And here's the problem. It's not only one test you're getting. Often you're getting 100 things. So let's just say, for the sake of conversation, we say 20% of any allergy test is falsely positive, and we put 100 things on your back. By definition, you're going to be positive to 20 things. Now, does that mean that information is not useful? Of course it's useful. But when you take those 20 things, you have to go back to the history and say, oh, Mr. Smith, Mrs. Smith, I see here you're allergic to grass. What happens when you roll in grass? What was like when you went to a picnic and you rolled in grass? What happened to you? And if Mrs. Smith said, well, nothing, well, then that's the false positive. So looking at allergy testing without documenting that that antigen actually causes a problem is pretty much worthless. Are there, rare cases, especially of people who have anaphylactic shock to unknown things in their environment? Of course, but we're talking bread and butter, your 60, 70% of people with allergic rhinitis. There's certainly a place for this level of deep investigative work for people who have serious reactions, unknown reactions that is causing serious reactions. But for the typical hay fever symptom, having skin testing that's not corroborated by actual symptoms can send you down the wrong road, especially if you're offered immunotherapy, which involves getting shots 3 times a week for often 3 to 5 years. You want to make sure, again, especially if it's not life-threatening, if you just have classic hay fever symptoms, and if you do have classic hay fever symptoms, it probably means you are allergic and you probably have figured out what you're allergic to. What I have seen, and I think the trouble part, is when people don't even have classic symptoms of hay fever, but somehow wind up getting allergy testing, and then they obviously are going to have some positive things, and then unfortunately, they may be offered immunotherapy or allergy shots.